Welcome to the weekly safety tip for the week ending June 23, 2017. Safety tip information. Fentanyl and the threat, Part 3. To close this series, we will discuss the pros and cons of using fentanyl. Upsides, fentanyl is a very strong pain-relieving medicine used for the relief of moderate to severe pain, that is unresponsive to less potent pain-relieving medicines. Available as an injection, transdermal patch or device, nasal spray, sublingual under-the-tongue tablet or spray, or buccal beneath the cheek tablet. Different formulations have different uses. For example, fentanyl injection may be used as part of anesthesia, to help prevent pain after an operation or procedure. Fentanyl patches or transdermal devices may be used for moderate to severe pain that requires round-the-clock therapy. Sublingual sprays or tablets may be used for breakthrough-type cancer pain. Fentanyl is a pure opioid agonist analgesic. This means that with increasing dosages, it provides increasing pain relief, unlike some other opioids that have a ceiling effect plateau off above a certain dosage. Downsides: if you are between the ages of 18 and 60, take no other medication or have no other medical conditions, side effects you are more likely to experience include nausea, vomiting, constipation, sedation, dizziness, lack of energy, shortness of breath, and abdominal distension are the most common side effects. May also cause flushing, sweating, itching, red eyes, and a drop in blood pressure on standing. Fentanyl should not be used in people who have never been prescribed an opioid analgesic. Opioid naive. Fentanyl is usually only available from a certified pharmacy under a special program. Fentanyl is a Schedule II controlled substance, and is up to 100 times more potent than morphine on a weight-for-weight basis. Note that different sources cite different equivalent dosages. In reality, there is a wide inter-individual variation between effective opioid dosages. Do not try to convert fentanyl on a weight-for-weight basis. For example, from patch to injection using the same dosage, because of extremely high risk of overdosage. It is always safer to underestimate fentanyl requirements. Because of risk of addiction and dependence, fentanyl patches should only be used for severe, chronic pain that requires round-the-clock, long-term opioid treatment and for which other treatments have been ineffective. Other forms of fentanyl such as sublingual spray or tablets may be used for the relief of breakthrough pain. Fentanyl should not be used for acute or postoperative pain, or for headaches or migraines. Keep out of reach of children and pets. Death has been reported in children and pets who have accidentally ingested fentanyl products. Fatal breathing problems have occurred in patients given fentanyl products. Risk is higher in those who have not been administered opioids before. Fentanyl has a high potential for abuse, and care must be taken to keep it hidden from drug seekers. Fentanyl is often used to lace counterfeit drugs. Several deaths have been reported, most recently from Xanax laced with fentanyl. May interact with other drugs, particularly ones that inhibit the metabolism of fentanyl, such as ketoconazole, erythromycin, and diltiazem, and those with similar side effects such as respiratory depression, sedation. May affect your ability to drive and operate machinery. Avoid alcohol. May not be suitable for people with pre-existing respiratory disease, head injuries, bradycardia, slow heartbeat, and other conditions. Response and effectiveness. Time to effect varies depending on formulation, from 15 to 30 minutes sublingual tablets, 46 minutes buccal tablets, 1.5 hours spray to 3 hours patch. Respiratory depressant effects can be seen from as early as 15 to 30 minutes after administration and persist for several hours. Notes: in general, seniors or children, people with certain medical conditions, such as liver or kidney problems, heart disease, diabetes, seizures, or people who take other medications are more at risk of developing a wider range of side effects. Bottom line: fentanyl is a very potent pain-relieving medicine. It is not recommended for people who have never been prescribed opioid-type pain relief before, and deaths have been reported from improper dosing or abuse. As always, thank you for reviewing the information in this week's safety tip. Have a great weekend, have fun and stay safe everyone. See you next week.